Just moments ago, the Energy and Commerce Committee moved through Obamacare repeal and replace, Paul Ryan's bill that he calls the American Health Care Act, that follows on a 4:30 a.m. approval of the same bill through the Ways and Means Committee. The next step is for next week for the House to take it up on the floor, then try to pass it through the Senate, and then it would theoretically go on to Donald Trump's desk. What is Paul Ryan thinking here? He introduced his bill on a Monday night. By Tuesday morning, the entire outside conservative infrastructure had condemned it. They called it Republican welfare. They called it Soros care. They called it Obamacare Light, Obamacare 2.0. They said this is nothing but a new giant entitlement that Republicans are putting forward. Aside from their critique, how is it that the coordination is so bad that Paul Ryan, who is basically a child of the conservative movement, didn't manage to get the conservative movement to back his own bill? I think what's going on here, and this is what I've heard from people who are close to Paul Ryan and who have heard him explain his thinking on this, is that Paul Ryan believes that this is his best bad possibility. In other words, everything else is much worse. And the only way that this gets through, he believes, is if Donald Trump believes that this is his bill, it's Trump care, his legacy rides on it, and he decides to get into it and uses his power to try to influence conservative members of the House and tell them, look, you may not like every bit of this, but you have to do it for me. You have to be, this is a matter of loyalty, and if you don't do it, I'm going to come down to your district, I'm going to tweet at you, I'm going to try to generate a primary challenge to you. And what this might remind people of is the opposite of what President Obama did. When President Obama put forward his own Affordable Care Act, left-wing groups said, okay, now the time is to go challenge blue dogs, go to these conservative Democratic districts and force them to get on board with a robust, extremely progressive bill, one that has a public option, one that drives down drug prices, one that gets industry under control, one that expands coverage and makes it universal. The president didn't do that. President Obama did not do that. If you remember, Rahm Emanuel even called that suggestion in a private meeting effing retarded. Instead, what they did is they catered to all of the conservative Democrats and tried to move the bill as close to the center as they could, hoping to get not just them, but some moderate Republicans as well. We know that no Republicans came along. They did eventually get enough conservative Democrats. The consequence, though, was that they produced a bill that was not popular. It left networks too narrow, it left premiums too high, and it left deductibles too high, and it left it vulnerable. If you notice, the thing that is most difficult for Republicans to roll back is not the exchanges, the kind of wonky area that kind of flowed out of this kind of technocratic culture. It's actually the single payer element, Medicaid, the Medicaid expansion. That is the part politically that Republicans are having a hardest time in rolling back. And so, the next few days, and then we can go to your questions. The next few days are going to be enormously important for the history of healthcare going forward. The next few days and weeks, Lenin has had a phrase where he said something like, there are decades that go by where nothing happens, and then there are weeks in which decades happen. And I think when it comes to healthcare, that's the kind of week or 2 weeks that we're looking at. In order for Obamacare to get repealed and replaced by this Paul Ryan version, Donald Trump has to go all in. If he doesn't go all in, then the House Freedom Caucus, which is the right-wing group in the House, is going to band together and they're going to crush the thing because they hate it in principle. And in fact, if they're true to their principles, they should hate it in principle because it is the same thing, effectively, as Obamacare. Obamacare uses tax credits to subsidize health care that people purchase in a private market. Paul Ryan's plan uses tax credits to subsidize health care that people purchase in a private market. The only difference is in degree, not in kind. Paul Ryan's is much stingier than Obamacare, which is already, as we've discussed, too stingy. People are paying too much out of pocket and too much for premiums. And so the preference of the House Freedom Caucus is to vote against this sucker. They don't care if it takes down Paul Ryan. They want a principled repeal. They have a very clever talking point, which is this. We've already repealed Obamacare 42 times. Put it on the floor a 43rd time, and we'll repeal it again. And what's so brilliant about that little talking point is that it exposes the depths of cynicism in Paul Ryan and Mitch McConnell's effort to repeal Obamacare 42 times or whatever the number is. Because the Freedom Caucus is saying, wait a minute, if you won't put it on a 43rd time, then were you not serious those other 42 times? Did you only put it up on the floor as a sop to the base, knowing that Obama would veto it when it got to his desk? And of course the answer to that is yes, that is precisely what they were doing, because now that they have somebody who will sign full repeal, they're not putting full repeal on the floor, and that is the Freedom Caucus's preference. Now, a Freedom Caucus member's first preference is to get reelected to Congress, and principals have a funny way of wilting under the heat of a primary challenge. The question there, though, is does Donald Trump have the power to generate and back primary challenges against right-wing Republicans in Republican districts? And I think the answer to that is unknown, but if I were Trump, I would not be terribly confident about that, as he has tried to organize protests and rallies in support of him. He had March for Trump on March 4th, and as you saw, tens of people showed up here and there. If he can only generate 10 or 20 people showing up in a town square, then it calls into question his ability to generate a real movement to take out some of these entrenched members of Congress. It may be the case that now that his backers have put him in office, they're tired. They're not organizing anymore. They feel like they've done their part. They elected a Republican Senate, a Republican House, and they put Trump in the White House, because when they ran in 2010, when the Tea Party burst onto the scene, it was about Obamacare repeal and rolling back the Obama agenda. They won the House, yet they couldn't roll back the agenda, and so Republicans said, well, we need the Senate too. So in 2014, they finally won the Senate. They said, okay, we have the Senate and the House. Now roll back the Obama agenda. And they said, well, Obama's still in the White House, so we can't do that. So then the grassroots went out, and now they put Trump in the White House. They're saying, we have Trump in the White House, Senate controlled by Republicans, House controlled by Republicans. Do what we want you to do. They're stepping aside. Now, if they still don't do it, you're going to see a massive amount of depression in 2018, which could allow Democrats to surge, take back both the House and even possibly Senate.
Okay, so I'm sorry.
Sure.
While you check that, I'm going to just quickly.
Sorry, go ahead.
Okay. No, keep going. Okay, so I wanted you to respond to some comments that have come through from the last video we posted to Facebook and YouTube, which is the Keith Ellison video as well. Right. Do you already have a question from Twitter?
Yeah,
okay,
do one of those, and then I can do Keith Ellison. So, if you guys haven't seen the latest Keith Ellison video, go check it out. He was asked, what should activists on the progressive side, make of his loss to DNC chair, and what does he have to say to people who are calling for Dem exit as a result? And his answer, he was interviewed in Selma, Alabama, and his answer basically was, I'm in Selma, Alabama. People have gone through far, far worse than losing a primary or losing a DNC chair. And if simply losing a single election for DNC chair is enough to make you throw your hands up and walk away from the process, then what were you doing in the first place? How committed were you to begin with? And he said, quote, buck up. Now there's been a lot of pushback from the people that he told to buck up, who haven't taken particularly kindly to being told that. My take on the situation is slightly less blunt, but it would be, taking over a major political party is not something that is easily accomplished. Nothing that's really worth doing in life is easy. If it were, what are you doing? And so, for the Bernie wing to be as powerful as it is within the Democratic Party is an extraordinary accomplishment. The fact that Keith Ellison is the deputy rather than the chair of the DNC is a setback. for that movement, but taking over the entire Democratic Party was never going to be done overnight. It is an ongoing process that requires constant organizing, and the moment that it is successful, it is under threat, and the organizing will need to continue. If people step away every time they lose, then they're just yielding the field to the people who haven't stepped off of it. So that's my take on what Ellison is saying. We do a question from Michael Saveland. Says, what is Trump Care doing about the ACA's individual mandate? The same, or are there changes? So the individual mandate, that's this a provision that a lot of people despise, which forces you to buy health insurance from a private company, which is an odious thing to think of, that you're forcing an individual to spend their money and give it to a private corporation. And people from the right and people from the left all hate this. Now, it's kind of a central piece that's required if you're going to subsidize health insurance, and if you're going to deal with pre-existing conditions, then you kind of need something that gets everybody into the pool. In other words, as long as you're guaranteed to be able to get health insurance whenever you want, the fear is what you'll do is you'll wait till you get sick, and then you'll buy insurance, and as a result, there's not enough money in the insurance pool to cover everybody who's sick. And so the individual mandate is the way that Democrats deal with that. Single payer would take care of it, then you wouldn't have to worry about people voluntarily getting in, because they'd be covered. The way that Paul Ryan handles this is I think the wonky term for it is idiotic. He takes, if you go for 2 months without insurance and then get back into the insurance pool, you don't pay a penalty like you do under the individual mandate. He calls it a surcharge. You pay a 30% surcharge, which means that, let's say it's a $3,000 premium, you have to pay an extra 30% on top of that for having gone without insurance. So if you know that, what are you going to do? What's your incentive? Well, you're going to go as long as you possibly can without insurance, because now you know you have to pay this stupid surcharge. So the second that you get sick, then you're going to go in, and then you're going to buy insurance, and you're going to pay your 30%, but you're not going to do it before you have to. And so Paul Ryan is all about being wonky and setting up incentives in the right direction. This incentive pushes you in the exact wrong direction. And he was actually on Fox News last night with Tucker Carlson. It's so dumb. Tucker Carlson annihilated him for it. He couldn't even get this past Fox News. Now, Tucker Carlson is not somebody you necessarily want to tangle with, no matter who you are, because he's awfully good at what he does, which is making people, look bad in interviews. But he did it to Paul Ryan last night, saying, "Wait a minute. So why wouldn't I just go for as long as I can without health insurance?" Paul Ryan had no good answer for that. It's a terribly poorly thought out thing, and it is in principle precisely the same as the mandate. The only difference being, with Obamacare, the mandate is annual and it gets paid to the government, and with this, you only pay the penalty when you get insurance again, and you pay it directly to the insurance company. So Republicans cut out the middleman of the government there. Tucker Carlson also crushed him for the tax cuts in Obamacare. So even over at Fox News, people are recognizing, wait a minute, so you're going to gut Medicaid and you're going to raise the cost of health insurance for millions of people, and you're going to take insurance from maybe 10 million or plus, and with that money you're going to give the very rich tax breaks? Even on Fox News, they're saying that doesn't sound like the problem that the middle class has right here. Let me see what else we've got. How long until the new Trump Care bill will be implemented after House and Trump's signing? And that's from E.J. Clark. So let's say that lightning strikes and this thing moves through the House, through the Senate, and Trump signs it. So the question then is how long until it's implemented? And here's one of the most interesting parts. So the Medicaid expansion, which is extremely popular, they don't want to get rid of it during 2018 when a bunch of governors, senators, House members are up for re-election in states where where Medicaid is popular. They don't want to throw everything into chaos, so it punts it now to 2020. At the time that it would unravel. But you'd say, well, why would they want to do it in 2020? That's an election year. And the Republican Study Committee, which is about 170 right-wing members of the House, have actually flagged this part of it in their objection to the bill. They say, wait a minute, you're not actually going to get rid of this thing in 2020. You're just telling us right now that you're going to get rid of it in 2020. If you're going to get rid of it in 2020, why don't you just get rid of it right now? The answer is they don't have the political will to do it right now, and they're punting it to 2020. What would most likely happen in 2020 is they would extend it for another couple years, and then extend it for another couple years. They compared it to what's called the doc fix, which finally was actually fixed and is no longer a part of our system. But for years, every year, Medicare reimbursement costs would be cut to doctors at the end of the year if Congress didn't do anything. So all year long, the doctors would be lobbying around this, and then at the 11:59 on December 31st, they'd pass a bill saying, okay, we're not gonna cut it this year. We'll do it next year. Then the next year, they would do this whole charade again, and they ended up never actually cutting it because nobody wants to deal with the political heat for doing that, and because it was a stupid thing to cut. And so eventually they finally fixed that, so they don't even pretend anymore that they're going to cut this. And so the House conservatives are saying, well, that's the same thing that you're doing with Medicaid. You're claiming that you're going to unwind it several years from now, but you're not actually going to do it. And they're doing the same thing with the exchanges that they say that will kind of move from the Obamacare tax credit subsidies over to the Paul Ryan tax credit subsidies over the next several years. That could easily take effect a little bit more quickly, that's what affects about 10 million people, between 10 and 20 million people around the country. But again, those things could be staved off by organized lobbying as well. And so that's why you have these conservatives saying, just rip the thing up root and branch. Stop pretending like you're doing this little bit here and there.
The Republicans are saying that Obamacare is collapsing anyway, and if that's true, then it seems like this is a rescue mission more so than tearing something root and branch.
Right, except it's not collapsing. And so the question here, are they actually rescuing Obamacare because it's collapsing, or what? And what about this rhetoric that Obamacare is collapsing? I mean, there's no question that premiums are rising faster than people would like them to. It's not a good plan. It's the deductibles are too high, premiums are too high, and the networks are too narrow, and that's a result of them listening to the technocrats and trying to keep the bill under this arbitrary cost of $1 trillion. Healthcare costs are rising less quickly than they used to. We saw a big bump in premiums over the last year, but the bump over the next year is not expected to be that high. Donald Trump has definitely gotten kind of high on his own supply here and believed the rhetoric that Obamacare is collapsing and will collapse under his own weight. And as a result, he believes that politically, and he's said this over and over, he believes that politically the best thing for Republicans to do would actually be to just let the thing collapse, and then when it does, they can ride to the rescue 2 years from now. But the problem is that that's not actually the reality. It's never going to be a great system unless they make improvements to it, but it will continue to cover these extra 20 million people. It will continue to improve the quality of care because it pays for care quality rather than care quantity. The Medicaid expansion will continue to be there. This. And separately, the way that this plays into the politics and what we were talking about earlier, if the House Freedom Caucus believes that Donald Trump is okay with them not repealing it right now and waiting for it to collapse 2 years from now, then they have every incentive to just vote no on Paul Ryan's plan, and that could cost the party badly in 2018, but they'll be just fine.